Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the author of the book Focused Neurology. Today we are going to talk about a very fascinating topic, the cranial nerves, part 1, the olfactory nerve or the first cranial nerve. So today we are going to talk about the olfactory nerve, that is the first cranial nerve. Olfaction is a phylogenetically ancient sensation in lower animals, especially dogs, in whom olfaction is extremely important. The olfactory cortex constitutes a large part of the cerebral hemispheres. Olfaction is the only sensation not directly processed in the thalamus. Anatomy. The olfactory nerve begins in the form of about 20 branches on each side of the upper nasal cavity from the bipolar cells located in the olfactory epithelium. These branches pierce the cribriform plate of the ethmoid bone and synapse with the mitral cells. The primary olfactory cortex is located in the medial temporal lobe, that is the hippocampus. Basal cells in the olfactory epithelium can regenerate, an unusual neuronal property. Olfactory receptor cells are continuously replaced by the newly formed cells. Olfactory, the first cranial nerve, clinical examination. Impairments because of the anosmia are not trivial. The problem is not merely that patients with disturbances of smell sensation miss out on some of the life's pleasures. They also miss olfactory danger signals such as spoiled food, smoke and leaking gas. Olfactory deficits are sometimes divided into conductive deficits and neurogenic deficits. Conductive deficits due to processes interfering with the ability of the organs to contact the olfactory epithelium, such as nasal polyps, and neurogenic deficits due to dysfunction of the receptors or their central connections. Smell is tested using non-irritating stimuli. Coffee, chocolate are suitable. Avoid substances such as ammonia. They may stimulate trigeminal nerve instead of olfactory nerve. The test order is placed under one nostril while the other is compressed and the patient is told to sniff. Age. Disorders of olfactory function. Age. It is the strongest correlate of olfactory decline. This impaired olfaction may be related to ossification of the foramina of the cribriform plate or early neurodegenerative diseases and degradation of receptor function related to repeated viral functions and other insults over the span of time. Head injury, craniocerebral trauma. It may cause damage to the olfactory nerves at the cribriform plate. So one of the important causes of anosmia is head injury. The neurologic causes of impaired smell includes olfactory groove meningiomas and frontal lobe gliomas. The Foster-Kennedy syndrome. The Foster-Kennedy syndrome consists of anosmia accompanied by unilateral ipsilateral optic atrophy and contralateral papilledema because of a large tumor involving the orbitofrontal regions such as an olfactory groove meningioma. The anosmia and optic atrophy are due to direct compression and the contralateral edema occurs when the intracranial pressure increases. Anosmia may also accompany some degenerative diseases, especially Alzheimer's disease and Parkinson's disease. In fact, anosmia may predate the clinical manifestations of Parkinson's disease by many years. Seizure focus involving the medial temporal lobe structures causes uncinate fits, which are complex partial or temporal lobe seizures preceded by an olfactory or gustatory aura. Other common causes of anosmia include local acute or chronic inflammatory nasal disease and heavy smoking. So these are all the important concepts of the olfactory nerve, the first cranial nerve. I hope you have enjoyed listening to my lecture as much as I have enjoyed delivering this lecture on the first cranial nerve, the olfactory nerve. Most of the important concepts of neurology I put it in a question answer format in my book Focused Neurology, written by me, Sreenivas, which is available online from all leading booksellers including Amazon. It could be bought online. I hope you have enjoyed listening to my lecture as much as I have enjoyed delivering it. If you have liked it, kindly subscribe to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts, and do connect to me on my email sreeklpm@gmail.com. Thank you. Bye.